I'm delighted to be back in Belfast again. I've been living in Dublin for I can't remember how many years now, but I'm originally from North Belfast, and it's great to be back in Stromulus. In fact, I went to Stromulus Primary School many moons ago. But what I'd like to do just for the last few minutes of the conference, and if you just bear with me, is just to draw together some of the key points arising from the conference. And with the way I'll do this, I'll not refer to anybody individually, but I'll just kind of try and draw out the key points. So I think the first point to be made is, despite all the challenges and all the difficulties over the last few years, there has been a lot of progress that has been made in the last few years. The imminent publication of the National Rare Disease Plan for the Republic of Ireland, and we're delighted to hear the Minister White here today saying that there's likely going to be a national office for rare diseases, and that's a huge plus for the Republic of Ireland. And the development of the National Clinical Programme represented by Professor Eileen Tracy. That is a really significant forward move from a few years ago. It's also fantastic to note the publication of the UK plan in 2013 and the progress that I know has been made on a daily basis towards the implementation of the 4 implementation plans, including the one for Northern Ireland, and those are going to be published very soon. And I think probably one of the most important outcomes of today's conference and last year's conference in Dublin as well is that I think there's a recognition that cross-border cooperation, both on a north-south basis but also on an east-west basis and at a European level, is a necessity. It's not something which is a vague aspiration, but it's something which is a necessity in terms of the treatment of people with rare diseases and disorders. So there's just, I suppose there's 5 different levels in which I think that cooperation can take place. And the most important one, and I put that one up first, it is at a patient group level. We often underestimate the impact that patient groups make towards improving care, improving treatment for people with a rare disease or disorder. And we've had some very moving testimonies today, and these are just some of the groups: cystic fibrosis, 22q11, MPS, motor neuron disease, muscular dystrophy. It shows the immense amount of work that is happening out there at a patient group level, often invisible, often people don't see it, but day and daily the work that is provided, the care that is provided to families and individuals, but also the lobbying that is being undertaken at a policy level to try and shape and improve services, which is absolutely crucial. And as part of that, I think what can't be underestimated is the role of national platforms, the Northern Ireland Rare Disease Platform, the Task Force in the Republic of Ireland, but also the individual networks, other networks that we're involved in as well. They play an absolutely crucial role in terms of the development of policy. I think the second key outcome of today is in the whole area of data, and we talked about the whole importance of registries, the importance of electronic patient records, and of innovative tools in relation to the care of those with rare diseases, such as patient passports. Registries are an essential building block of efficient and effective treatment for rare diseases. They provide information on where services should be targeted. They provide the basis for clinical trials happening in Ireland, North and South. And they also show trends in terms of outcomes from treatment. We've also heard the importance of electronic patient records, and they're increasingly taking the place of paper records. Northern Ireland is far more advanced in this context than the Republic of Ireland. We still are very much reliant on the old paper records. But it's not just important at a hospital level. We've heard the example of the NICR, the importance and potential of those records being used at a regional level as well, and also the innovative tools of healthcare passports, which is something we will certainly be bringing back to the policymakers in the Republic of Ireland. So the third key outcome from today is the importance of clinical trials and research, and increasingly clinical trials for new drugs, not only to improve the conditions of people with rare disease and disorders, but also, dare I say it, even, and I say this very carefully, for some groups, the word cure is actually coming on the horizon in terms of some of the fantastic therapies that are coming along. They come at a huge cost, a huge investment in time and resources, but we need to ensure that that time and resources is spent on rare diseases as well as other more common conditions. So that we need to ensure that there is equality in terms of if new therapies come along for rare disease and disorders, that they are resourced and funded by government and they're not discriminated against. We've also seen the potential of joint fundings for research, and increasingly academics are coming together on a north-south basis to put in applications to Europe for Horizon 2020 funding and other funding sources to ensure that there is effective research on rare diseases and disorders. We've also seen, I suppose, highlighted today is the importance of expert care and specialised centres. The point that was made earlier on today, there's a need for a minimum number of people to attend the centre to make an expert centre. So it's really vital that cooperation on a north-south and east-west basis continues. And for the more common rare diseases and disorders, it certainly can justify the development of centres both north and south. But for less common rare diseases and disorders, it may require treatment abroad. And it's quite clear from some of the testimony that we've got today, and indeed over the last few days in the Republic of Ireland, that some of those who need that treatment are not being resourced to get that treatment abroad or find it very difficult to access it. We've also heard from many people today about the importance of prompt diagnosis and the need for screening, and those are areas that there still needs to be huge improvements. Just on that last point too, and this is an interesting one which I think needs to be further explored. A point was made earlier on the day, is the need for expertise to travel rather than patients, which is an intriguing one, because I think we're constantly thinking of patients have to travel where the expertise is, but maybe it's a case of expertise should be travelling to the patients. And finally, I suppose the level that we discussed today, and it probably is most controversial, is the political level, and I think probably there's a mixed reaction to the political response to the need for improved services for those with rare diseases. Yes, there has been progress on rare disease plans. Yes, there's greater visibility about rare diseases in Ireland, North and South. And yes, we can see the commitment of Minister Poots and Minister White. But I think the point was very eloquently made, especially by Michael. You know, politicians are easily distracted by firefighting, by another political crisis, and all of a sudden rare diseases drops off the agenda because of something else. And still, I get a strong sense from the anger that I heard in some of the voices today, a strong sense of the inequality in relation to the care for those with rare diseases and disorders. And still, perhaps there is a mindset that some rare diseases are an afterthought, and that sense of discrimination and inequality which is there, and it's something that we'll need to continue to fight, and I would say it's going to persist for many years to come. But I think the strength that is here today from the patient groups shows that I think inroads is definitely being made in that context. So just final slide is that I think to finish on a very positive note, 2014 is a period of hope. There's been substantial progress has been made in relation to addressing the needs of those with rare diseases, the plans and so on. But it shows that there's a huge amount of obstacles still to be overcome. Cross-border cooperation must be a key dimension of the Republic of Ireland and Northern Ireland implementation plans. Yes, progress has to be made on the 5 levels, but we're still at a relatively early stage. We still need to push the politicians and the policymakers to ensure that progress increases. Yes, there are new therapies coming along, but the cost issue is there, and it's something that we'll need to continue to struggle to ensure that those new drugs are made available for our patients. And also, I think probably the final point is the importance of patient groups, the importance of yourselves here today. At the end of the day, there's a lot of cooperation between clinicians, between policymakers, between science and industry, which is a very, very important part of the equation. And there are pharmaceutical companies who are represented here today, and that should be remembered as well. But I think it's the direct voice of patients and patient groups which really make the difference. And I think that voice came out really loudly and strongly today. So I think that offers a real message of hope going forward. So thanks very much.